So if you exercise, then you're contracting the muscles, and the muscles are becoming stronger, and there's a pull of the muscle on the bone, there's a pressure built on the bone, and the more pressure builds on the bone, then the bones are becoming thicker and stronger. But on the other hand, if you do not do any kind of physical activity, your muscles become weaker, so it means there is less contraction on the bones, and when that happen, the bone become also weaker and thinner. So just takes a few weeks for the bone to become very weak. So physical activity is very important all the time. There is different nutrients and different hormones that are important for normal bone growth and development. Calcium and phosphate, especially calcium, is really important, and that's why you have to take regular calcium through food. There's also other minerals that are there, like magnesium, manganese, iron, fluoride. There's also sodium and potassium are there, that are important for the bone growth and maintenance. There are some vitamins. Of the vitamins, vitamin A stimulate osteoblasts. So osteoblasts, as you know, it makes the bone matrix. B12 and vitamin K, these are the ones that are important for formation of other types of proteins in the bone. And vitamin C is really important because it differentiates pre-osteoblast to osteoblast, and also stimulate osteoblast to make bone matrix. So vitamin C is really important for the bone formation. There's also hormonal factors that are there. So one is calcitriol and cholecalciferol. This is something that you should remember from chapter 5. These are especially the calcitriol is the end product of vitamin D that is has been converted from cholecalciferol in the kidney. So cholecalciferol when it goes to the liver and changes to intermediate metabolite, and then it goes to the kidney, and that makes calcitriol. And that is important for absorption of calcium and phosphate from intestine, and also reabsorption of calcium from the kidney. Bone growth, growth hormone is also important, and that is for increasing mitosis in the cells. Okay, it is in all other cells, but also in the skeletal system. Thyroxine is important for increasing metabolic activity of different tissues, so it is very important for development. So if somebody has a decreased level of growth hormone or thyroxine during childhood, this person will be short. Sex hormones like estrogen or androgen, which is testosterone, for example, these are also important for bone growth and development because they stimulate osteoblast. Calcitonin and parathyroid hormones, they are important for balance of calcium, and I will talk about it in a couple of minutes. So why calcium? So calcium is really important for the body because the nervous system activity depends on the calcium. When the time comes, I will tell you how. Also, the muscle activity and contraction, especially the heart muscles, need calcium. All other muscles also need it, but the heart, as you know, is vital. These two very important. So if there is a decreased level of calcium, then the person will have muscle weakness, or they may have arrhythmia, which is irregular heartbeat. There's also different enzymatic activities that are important inside the cell, and they require calcium. So when the body needs calcium, the level of calcium decreases. This is why calcium should be released from the bone. So the health of bone become a secondary issue for the body. The other normal homeostasis becoming more important at that time. So the level of calcium in the body is really important. It's a very short or narrow normal range for homeostasis. So if the level of calcium decrease, okay, then the parathyroid hormone is released from the parathyroid gland, and that will cause what? It will go to the bone and activating osteoclast indirectly, and the osteoclast, as you know, it will cause release of acids and enzyme, and that will damage the bone, that cause bone resorption, and the calcium goes to the blood, and the calcium level increase in the blood. Another one is it can cause increased absorption of calcium in the intestine. That will also cause increase in the blood calcium. And the third one, it will cause reabsorption of calcium from the kidney, which means this decreased calcium loss in urine. At the same time, the parathyroid hormone increase calcitriol, and the calcitriol is important for absorption of calcium from the gastrointestinal system and reabsorption of calcium from the kidneys. So all these three mechanisms will cause increase in the calcium level. Once the calcium level increase, this will inhibit release of parathyroid hormones. Everything goes back to normal. If the level of calcium is high, what will happen? The parafollicular cells from thyroid gland, see this thyroid, not parathyroid, from thyroid gland release calcitonin. So calci actually means calcium. So it's an easy way to remember it. So this is in response to increased calcium level. This will cause inhibition of the osteoclast, and if the osteoclasts are inhibited, then bone resorption will not take place, and the osteoblasts that are there, it will cause increased bone formation, and when more bone is formed, then more calcium precipitate in the bone, and the bones become thicker and stronger. Another one is the decreased absorption of calcium from the intestine, and decreased calcium absorption, reabsorption from the kidney. So more calcium is lost in the kidney. Also, the level of calcitriol decrease in the kidney, so it is again, it has less effect on the intestine, on the kidney for reabsorption of calcium. And so all these mechanisms together, what will happen? The calcium level will decrease.